So, today we're going to be talking about PPE and safety in COVID 19. And we know because of the infectious nature of COVID, personal protective equipment and safety is a priority before we go to manage these patients. So, we have to be safe first. So, when we're talking about this in this area, we could split this up into two areas. We could talk about personnel safety and ventilator safety. So I was going to share some considerations that would be important. Now, I know we all know about the different types of PPE. They've been through this in various drills in all the different hospitals. But just to summarize, remember for intubation, we need to have aerosol level protection. So that would be an N95 mask. And I know the reality of the situation is that the mask may not fit as desired. So that N95 may not fit you as well as desired. So if you want to increase your coverage, or you should be doing it anyway, is put on a surgical mask over your N95. And that would increase your protection. The other thing you need is your disposable fluid-proof gown. Now, these gowns come in two different varieties. So you have your normal fluid-resistant surgical gowns, your normal blue gowns. These gowns are disposable. And you have the bunny suits with the hood. These are the hazmat type suits, and you would see that in more the designated COVID areas of your hospital. The other thing you will need to have is a neck covering if you don't have no hood. That is, if you don't have the bunny suit. And if there is no hood as well, you will need to have your disposable cap, right? And the other thing you need to have is two pairs of non-sterile gloves. So one glove is under the gown sleeve and one over the gown sleeves. You also need to have either goggles or an eye shield. Okay, you can use either or goggles or eye shields, whichever one you have. And regarding footwear, the recommendation is not to use shoe covers. So boots are recommended, or something that you could easily take off and you could easily disinfect it and you leave it in the COVID area. So in the event that you need added coverage, a yellow gown over your gear may be query that may be useful. So just to get the two sets of options kind of in your mind a little bit. This one here is the full bunny suit from Italy with the hood, right, that covers the face. And then there's the visor, the N95, the gloves on. So that's one option. So as a full bunny hazmat with the hood. This is another option here from the US. This is courtesy Jeff McMurray over Twitter. And what they use is a normal blue surgical gown, but to make the hood, they just cut a window in a garbage bag, covered it, and they put the visor over it. So two options, right? You may or may not, depend on the setup you're working in, have access to either. Have access to one specific one. So another tip when you're wearing your PPE, which is a helpful tip I found, is you should wash your glove hands before doffing, and wash it regularly with alcohol to prevent spread of the virus, especially when you're touching stuff. Now, the other big aspect now is ventilator safety. And two main areas we're talking about here: the use of the viral filters and the 3Cs technique. This is the technique proposed by Scott Weingart, and it's really a summation of three particular actions in events of planned disconnection. So we know about the viral filters. It's very common to us. We, most practitioners, would know about it. But what you want to do for COVID, so you have two filters set up. So your HME or your viral filter at the patient end, and that's usually a green-yellow filter, and a HME or viral filter on the expiratory limb. So on the expiratory limb, you have another filter there as well. So that two filter setup. Now, question whether you need an inspiratory filter. Most vents do have a filter already. That is a reusable filter. So most vents would already have a sort of filter there already. And remember, for these filters, the viral filtration efficacy must be more than 99.9%, and that is, for example, the intersurgical type HME filters. Now, the other thing that we must be mindful of, and Scott Weingart summarized it as the 3Cs technique, and with that technique, is a sort of a combination of three things, and is a combination of communication, clamping, and cutting the flow on the ventilator. And this is in the event of a planned disconnection. So a disconnection, unplanned and planned, could be very dangerous. So why would you want to have a planned disconnection? Well, for example, if you want to turn your patient prone, you might want to disconnect. If you want to put in a suction catheter, and all these could be very dangerous maneuvers if not planned properly. So the first thing you want to do is communicate. Right? So you discuss how you're going to do it. You discuss everybody's actions. So you pre-plan. The other thing you want to do, especially if you want to put in a suction catheter or turn the patient prone, is clamp. So you need to tape the ET tube. So you don't want to clamp the tube directly. So you tape the ET tube and the clamp over the tape if you're disconnecting the patient or you are proning them. And the last one, which is the cut flow, this is very important because when you disconnect that the angle from the endotracheal tube adapter, that ventilator is going to be constantly blowing and spreading viral particles. That will be very dangerous. So what you need to do is identify your inspiratory tubing and disconnect that before you make the disconnection. Okay, and you're disconnecting that after the inspiratory limb filter. So it's very important. So you want to disconnect to put in a suction catheter, you disconnect your inspiratory limb. You're pre-oxygenating with your ventilator, you're ready to intubate. Before you move that mask from that face, you disconnect the inspiratory limb. Otherwise, you are going to be blowing viral particles all over the room. And the other thing you could do is put the vent in standby mode as well. That would achieve a similar thing.